Hello, everyone. I'm Cedric Peterson of the Department of Communication under the Ministry of General Affairs, and on behalf of the Department of Collective Prevention Services within the Ministry of Public Health, Social Development, and Labor, I welcome you to our third edition of Ask CPS. Now, based on our national response towards stopping the spread of COVID-19, it was determined that a program that allows CPS to explain the science behind the fight against the spread of COVID-19 is critical to the public and, of course, for the public to follow. By this program, you're able to update yourself weekly with regard to what's currently happening on the island as it relates to COVID-19. The department will also address questions received from the general public. In this edition of the program, we have our invited guests representing CPS. Of course, we have our head of the Department of Collective Prevention Services, epidemiologist, Mrs. Ava Lister de Weaver. We also have epidemiologist, Dr. Raisa Chonkonfat. And our guest in this edition of the program are surveillance nurses. We have Mr. Edward de Cuba and, of course, Ms. Kalila Blyden. I would like to welcome everyone to the program. Well, of course, I'd like to have my first opening words take place by the head of the department, Mrs. Ava Lister de Weaver. Good afternoon and welcome to the program. Great to have you again.
Thanks, Cedric. Good evening, St. Maarten, and thank you for taking the time to listen to this episode of Ask CPS. Tonight, we will be discussing some of our preliminary data findings, which will be an update from the information that we presented and discussed on episode 1. We've also been receiving questions from the public about the role of CPS and what our mandate is and what work do we actually conduct on a day-to-day basis. So I will be providing an overview of who we are and what we do. I'm also happy to have some of the nursing staff from CPS here this evening to provide additional information on contact and source tracing as it relates to COVID-19, and we will wrap up the segment with a brief overview and demonstration on masks and how to wear them appropriately. We hope that you find this session informative and look forward to receiving your questions. Thank you.
Ava, thank you very much for your opening remarks and, of course, welcoming everyone to this third edition of the program. The topic we want to get into today, we're going to spend some time talking about the roles and responsibilities of the Collective Prevention Services under the Ministry of Public Health, Social Development, and Labor. First question, Ava, what is CPS and what are the primary tasks of the department?
Absolutely. So Collective Prevention Services, or CPS, is one of the executing arms of the Ministry of Public Health, Social Development, and Labor. And we are primarily responsible for infectious disease surveillance, health promotion, health awareness, vector control, youth immunizations, and a youth dental care program.
Okay, is CPS one organization or are there departments that fall underneath CPS?
So CPS consists of two sections. So there is the youth healthcare section and the general healthcare section, of which under surveillance and health promotion falls under. In terms of what these departments do, so general healthcare conducts health promotion activities in the community and in schools. So this focuses anywhere on topics of interest such as healthy eating, healthy lifestyle, healthy sexuality. We also have the surveillance team that falls under this section, which the community is very familiar with right now. So where we do active disease surveillance and reporting. Persons in the community may also be familiar with the vector control team that canvasses the neighborhood and conducts inspection for mosquito breeding sites. That too falls under the general healthcare section. The second section, youth healthcare, is responsible for baby wellness visits, including breastfeeding support to new mothers, youth immunizations. They also go out to the schools to provide immunization, education, and awareness. And there's also a dental program that falls under the youth healthcare, where information sessions are provided to school-age children on oral hygiene. So it's a multifaceted department, but essentially health awareness, health promotion, and disease surveillance and immunization is sort of our day-to-day tasks.
That's amazing. Now, in the event of COVID-19, with all that you already have on your plate, does this now change the way you work since this pandemic has affected us?
Absolutely. So over the course of the past month, we've tried to keep business as usual, especially as it pertains to vaccination and vaccination schedules. The last thing we would want to happen is actually have an outbreak of a vaccine preventable diseases and have all of these younger population be susceptible and vulnerable. So we've tried our best to actually keep that program on track as best as we can. But of course, due to the demand of COVID-19, with case and contact tracing, some of our youth healthcare nurses have graciously offered to support the surveillance team, Edward being one of them, while some remain with the youth healthcare program.
Now, you mentioned source tracing. Raisa, I want to turn my attention to you at this particular point. What do you mean when you say contact tracing, and what about source tracing? What exactly is that?
So contact tracing means identifying everyone that a person with COVID-19 has come into close contact with. So let's say someone tests positive for COVID-19. What we'll do at CPS is call them or a close family member if they're unable to speak for themselves. And step by step, we'll write down everyone this one person has been in close contact with from 2 days before they started having symptoms. And we call each and every one of these contacts, and they'll receive information on quarantining themselves. So this means, you stay at home and you monitor your symptoms. And CPS will continue to call them up to 14 days after their last contact with the person with COVID-19. So you have to think of it as this is the person with COVID-19, and there's just a spider web around them. And those are the people that they have contact with. And what we do is we monitor the web of the people. If any one of those persons develop symptoms, we'll test them. And if they test positive, then we'll follow the entire protocol again. So that's for contact tracing. Then you have separately source tracing. We do both. We do source and contact tracing. The source tracing, that's a bit of kind of detective work, CSI work for those who watch CSI, but for diseases. So we try to find the original source of the infection. And what we'll do is we'll try to understand what someone did in the 14 days prior to getting symptoms. And we'll trace back all the steps they took. So where did they go? Who did they get in contact with? All the steps within the 14 days. And we try our best to identify how the person with COVID-19 acquired the infection. But we don't always find the original source. So when we look at Sint Maarten, the source of infection in the first cases came from travel to other countries. After that, we saw that we had more people who came into contact with a person with COVID-19. And now we're also seeing in our follow-ups that we can't always identify the source. So then they're classified as unknown source. So this is in a nutshell what we do with source and contact tracing.
Thank you very much for clarifying that. We want to get into the step-by-step process when someone is tested positive. And at this point, I'd like to turn my attention to our surveillance nurse at the Department of CPS, Kalila Blyden. Kalila, welcome to the program. A question we want to ask you, when a person tests positive, what happens exactly?
Okay, a person is tested positive of COVID. We at CPS, the nurses, we contact that individual. We, of course, go through the isolation procedure again, because that person has to then again isolate themselves, if possible, at home from their family members. So if they have a room that they can isolate themselves in, we ask them to do so. We also remind them, of course, about their etiquettes, if in case it's not possible to isolate themselves, cough etiquettes, sanitary measures, washing of hands, cleaning of your surfaces, and we also ask them for information of the persons that they have had close contact with 2 days prior to the symptom onset, as Raisa explained earlier. And with that, we gather that information, and each individual would be contacted. And those persons, again, we will go through the steps that they would have to go into quarantine for 14 days. So no one go by them, they go by no one. They stay home, and we do follow up with them, and we advise them if they do develop any symptoms within those 14 days to contact us at CPS, and those persons would be tested.
Thank you very much for your response, Kalila. The next question is for Mr. DeCuba. Edward, first of all, welcome to the program. How will you find the source, how a person got infected? How does that take place?
All right, good evening. As Riza indicated earlier, what we do is from the person that has been tested positive, we look 14 days prior and basically follow step by step where all they have gone. So you have to imagine that for 14 days prior to their symptoms, we look basically per day, per hour, where they all have been. And that way we try to find out where they could have been, where they could have contracted the COVID-19.
Okay. Okay, so let's look at testing now. How do you go about testing? And number one question people normally get or ask when they go through this process is, does it hurt?
All right. So with testing, basically after you call or your doctor calls in, the nurses call the person. We make an appointment to come visit you. The following day we come by your house. The process is that when we come, we give the full explanation of what's going to happen. Basically, it's a small swab that goes in each nostril. What we indicate to the persons is that you might feel a little teary-eyed. It might feel a bit uncomfortable, might give you the sensation to sneeze. And if any moment that they feel a bit uncomfortable, they raise their hand, then we stop. It doesn't hurt, but it does feel a bit uncomfortable.
Okay, Edward, how far up my nostrils are you going here to actually get the sample or test?
It's when you look at the swab, it seems very big, but it only goes very short in, a few centimeters.
Okay. Kalila, when it comes to the telephone number 914, when should I call that number?
Person should contact 914 when having flu-like symptoms, so coughing, fever, or runny nose. They should contact 914.
Now, am I allowed to call 914 even if I don't have a family doctor?
If you have a family doctor, we advise that they call their family doctor first, but if not, they contact 914. And that person will be tested.
Okay, great. Thank you very much for that, Kalila. The current numbers, where do we stand right now as of today's date? Ava, can you give us an update?
Sure. So over the past 3 days, I can report that we have had no new positive cases and our confirmed number remains at 76. While this is encouraging, this does not mean that we can become complacent. So we have to continue to observe the public health measures that are in place. We did receive a question on whether CPS has noted any trends in gender and an explanation for this. And I can say that when we were looking at our preliminary data, and looking at the distribution of our confirmed cases, we noted that about 71% were male and 29% were female, which is quite a disparity. The same can be said also for the fatal cases as well. An overwhelming majority were males. And when we look at current evidence and research around the world, similar trends are noted. When we looked at our average age for persons confirmed with COVID-19 on Sint Maarten, the average age was about 49 years old. And we've also observed that over 30% of persons with COVID-19 have underlying conditions such as diabetes, cardiovascular disease, including hypertension, obesity, and asthma.
Interesting. Thank you so much for the update there, Ava, for bringing us the current data as your department is doing the research and, of course, bringing us some information as it relates to the update as how this particular pandemic is affecting us locally at home, which is very essential for us to continue to plan and people making, of course, choices in their lifestyle. It actually makes us kind of wake up to the possibilities of making sure that we personally make sure our health is in check as we're dealing with this. So thank you very much for the update. As we go into the break, we want to invite you to stay with us. Coming up in our next segment, we're going to talk about the strategy that CPS is engaging in order to stop the spread of COVID-19 here at home. Stay with us. You're viewing and listening to Ask CPS.
In a world of COVID-19, it's essential that we all stay informed. Tune in to Ask CPS every Tuesday at 6 p.m. on Facebook.com/SXMGOV and on St. Maarten Gov Radio 107.9 FM. Ask CPS, where you can receive the latest information about COVID-19 and have your questions answered by the professionals of the Department of Collective Prevention Services. Ask CPS. Together, let's crush the curve. Coronavirus is most likely to spread from person to person when we come into close contact with one another. We can all help stop the spread by keeping our distance. This means do not shake hands or exchange physical greetings, and wherever possible, stay at least 1.5 to 2 meters away from others. It's also really important to practice good hygiene, especially after being in public places. Together we can help stop the spread and stay healthy. Visit stmartengov.org/coronavirus or call 914 to learn more. This public service announcement is brought to you by the government of Sint Maarten. The following public service announcement brings to you a few of the many unsung heroes in the medical profession who are working tirelessly to put our needs ahead of theirs and in the midst of this battle to prevent the spread of COVID-19. Listen closely to their message so that we all can remain safe.
Hello, my fellow St. Martiners. I am Nurse Carty from the Ambulance Department. We are now facing a very crucial time. Please adhere to the instructions given. Follow good hand hygiene, social distancing, and please stay at home.
My name is Angelo Martina. I'm one of the supervisors of the emergency room. Let's fight this. Stay home.
I am Dr. Sameh Nadari. I am internist at Sint Maarten Medical Center. I am here for you. I am at work for you. So please stay at home for us.
My name is Andrele Ellis, pharmacist of KL Pharmacy in the Sint Maarten Medical Center. Please stay home.
This public service announcement is brought to you by the St. Maarten Medical Center and the government of St. Maarten.
Hello, everyone. Welcome back to Ask CPS, Episode 3. CPS is now going to get into the discussion in regard to the public health strategy of St. Maarten. Ava, when you spoke about this in Episode 1, can you explain again what the strategy is for COVID-19 and what is the goal?
Absolutely. So the goal of our current strategy is to suppress transmission of COVID-19 and provide medical care to all persons. So we are doing this by identifying cases as early as possible, prompt testing, isolating cases and or their contacts, and contact tracing. Another aspect of our strategy is ensuring that public health measures and social measures are in place. So for example, the social distancing, the restrictive movements of the population, so the partial lockdown that's been in effect for several weeks. We have also had our community outreach and engagement, which Raisa will speak to later, and promotion on preventive measures for COVID-19.
How long are we going to keep it in place in regard to this particular strategy?
So I think ultimately the decision rests with the EOC. However, from a public health perspective, lifting whatever measures that have been put into place over the past few weeks is dependent on a few factors, which include things such as case resurgence. So is our public health system robust enough to be able to rapidly identify resurgence of cases? The strength of the public health system to be able to identify, isolate cases, and or quarantine contacts effectively. Also looking at the strength of the ability of our healthcare system to handle that extra patient load or that surge and provide medical care. And then also looking at our adherence in a general with the general public. So, are they adhering to physical distancing? Are we adhering to the 2 meters while we're in the streets and in public spaces? Are we staying at home as much as possible? Are we, are organizations taking the appropriate and necessary measures that have been implemented and asked by the EOC? And I think it's very, having a phased approach to opening back the island, so to speak, and restricting and reducing the restrictions. There needs to be a fine balance because we don't want to open too quickly and risk a resurgence of COVID-19 cases. But as I mentioned earlier, the ultimate decision would lie with the EOC.
Are these measures taking into account the dense population that you spoke about as well in episode 1?
Yeah, I think they are. And I think this is especially true with our community outreach and ensuring that we adapt our strategy to each neighborhood or district. We are simply not doing a one-fits-all approach. And I think that holds true especially for the different neighborhoods and districts that we are canvassing currently.
That segues into the next question. Raisa, what have you been doing to improve the community outreach?
So what we've been doing for community outreach is with a large group of community volunteers, we have been going to different areas. And the goal of this community approach is to bring awareness to persons that might not be receiving this information via the regular channels that are being used. So we tailored this information to be in different languages, for instance. And a lot of people have also been asking me what can they expect if they live in these neighborhoods. So what really happens very specifically is volunteers, they go door to door and they give information on COVID-19. When they're in this conversation with someone, they also ask whether there are persons in the household with flu-like symptoms. We ask residents if we can record their contact information so that the CPS nurses can follow up and call these persons. And during this follow-up phone call, the CPS staff will discuss if we can go test and if we can test at their house. So far, we've been to areas in various districts and neighborhoods. We've been to Sucker Garden, Cahill, some areas in Cul-de-Sac, Cole Bay and K-Bay. And of course, we'll keep the public updated on the next neighborhoods that we will go to.
I keep hearing about the term hotspot, Raisa. What exactly does that mean?
So in epidemiology, we don't really use the term hotspot, but we do use the term clusters, which is similar in meaning. And a cluster refers to cases that are thought to be linked to each other at a certain time or place. So this means, for instance, a group of people with COVID-19 that work at the same place or went to the same event or live in the same area.
Can those be identified here at home?
So there are certain areas where we see more cases, but at the moment it's not clear yet if these can be considered large clusters.
You're viewing and listening to Ask CPS. The next half of our program, we're going to get into questions in regard to talking about mask use, how to properly take on, put on, and take off your mask to ensure that you do not infect yourself. This and more coming up as Ask CPS continues. Stay with us.
The following public service announcement brings to you a few of the many unsung heroes in the medical profession who are working tirelessly to put our needs ahead of theirs and in the midst of this battle to prevent the spread of COVID-19. Listen closely to their message so that we all can remain safe.
Good day, St. Maarten. My name is Emiko Birdlake, cardiologist here at St. Maarten Medical Center. We are now in a medical crisis and we need you to help save lives. So we're asking you to please stay at home, bond with each other. Please help us save all the lives possible. Stay at home.
Hi, I'm Nurse Moni Gomes, a registered nurse at the Sint Maarten Medical Center. I am here to tell you all, remember the number 1 step, wash your hands, and number 2, stay at home.
This public service announcement is brought to you by the Sint Maarten Medical Center and the government of Sint Maarten.
Une épidémie mondiale a été déclarée causée par le coronavirus COVID-19. Voici quelques conseils de santé à garder à l'esprit pour vous protéger, vous et votre famille. Surveillez votre santé pendant 14 jours après avoir voyagé. En cas d'apparition de symptômes de la maladie, toux et fièvre ou sensation de fièvre, il ne faut surtout pas se rendre directement chez le médecin ou aux urgences, mais d'appeler à l'avance. Maintenir une distance d'au moins 1 mètre avec les personnes qui toussent ou qui éternuent. Si vous avez besoin d'une assistance immédiate, il convient de faire appel à votre médecin traitant ou aux urgences. En cas d'infection, informez votre médecin de vos symptômes, de vos voyages récents ou si vous avez été exposé à une personne atteinte de COVID-19. Pour davantage d'informations sur le coronavirus COVID-19, un numéro a été mis en place au 914. Cette annonce de service public vous a été présentée par le Centre d'épidémie et de la prévention et le gouvernement de Sint Maarten.
Hello, everyone, and welcome back to our last segment of Ask CPS. I'm Cedric Peterson, joined with my colleagues at the Department of Collective Prevention Services. In this last segment, we're going to get into the discussion and, of course, the process of masks, how to put one on and how to properly put one on and what masks are available. So let's get into the first question. What is the proper way to wear a mask? Actually, you know what? Let me turn it around. Edward? Let's start with what type of masks there are, and then we're going to talk about how to put them on properly. Can you help us out with that?
Of course I can. All right, there are different masks. I'll try and show you. This is the N95. Most commonly you see around the people with the surgical masks, and also, for example, cloth masks. All right. So those are the 3 main types of masks that are seen. The first 2 are mainly used in the medical field, with the N95 being for healthcare workers. And the surgical mask and the cloth mask you see more commonly or is advised to be used in the public.
Could you show us how to put it on and to take it off properly so that people get a good idea?
All right. So with everything, you start with proper hand hygiene. So washing your hands with soap for 20 seconds, or if not available, using a hand sanitizer, hand rub. So with this, for example, you have the mask. With the surgical mask, there's one side that's a lighter color than the other. The lighter color being the part that goes against your face. You put it over, behind your ears, adjust it, pinch the nose, and that's how you put it on the surgical mask. When taking it off, again, use hand sanitizer to clean your hands. Behind the ears, take off the mask and dispose of the mask after use. These masks the surgical mask is a one-time use mask. So as soon as you're done, you have to dispose of it. With the cloth mask, on the other hand, you can go home and wash it and reuse it.
I think one of the chief questions is, especially with regard to the surgical mask, is how long can I keep a mask on?
All right. The advice is that you can use the mask up to between 3 and 4 hours. But once it gets dirty or becomes moist, you would have to change it.
So, clarity, can I reuse the mask?
If it's a cloth mask, you can reuse the cloth mask. You will have to wash it and when it's dry, you can reuse it. But all other masks will have to be disposed after use.
Ava, maybe you can help us out with regard to the question I have in regard to access to masks. Is that something that we are seeing as a department in regard to people having access, ease of access to masks? Is that something that is currently available to all?
So I will say that from CPS's perspective, if you are a client of ours, so if you are confirmed with COVID, we do provide you with a mask, with surgical masks, so that you can properly isolate yourself from the rest of your family. I will say I'm not sure what the general supply is on the island. And this is why we advocate, if you do want to purchase a mask, whether it's a cloth mask or a surgical mask, you leave the N95 masks for healthcare providers. So it's not a service it's not a commodity that CPS provides unless you are in our care.
Thank you very much, Ava. And of course, Edward, thank you very much for giving us the description of what the different masks are, how to put one on and take one off properly. And of course, encouraging that it's important before handling the mask that you actually do make sure that your hands are clean, which is vital to the success and use of the mask during this time. As we're closing out the program, I'd like to invite the head of CPS and, of course, epidemiologist of Sint Maarten, Mrs. Ava Lissa de Wever, to present her closing remarks. Ava?
Thank you, Cedric. So I hope this information session was informative. And if you have any questions or concerns, please feel free to contact 914 or through our new email account, askcps@stmartengov.org. Again, if you are experiencing any signs and symptoms, I urge you to contact your doctor. And if you don't have a doctor, feel free to contact 914. If you have any questions or concerns at all, CPS is there to answer any of your questions. If you need advice, please do not hesitate to give us a call. We look forward to receiving your questions and answering them at next week's session. Thank you all for listening and have a good evening.
Thank you so much, Ava. And of course, thank you to the members of our panel for this evening's discussion. Let me take that one more time. 3, 2, 1. Thank you very much, Ava, for your closing remarks. And of course, I'd like to thank the members of our panel for being a part of this episode of Ask CPS. And to our radio and television viewers and online viewers, thank you for tuning in and being a part of the program. If you've missed this broadcast, be sure to tune in for video on demand at the official Facebook page of the Government of Sint Maarten. That's facebook.com/SXMGOV. Be sure to also subscribe to the official Government of Sint Maarten YouTube channel. That's Government of Sint Maarten. And of course, for radio, be sure to tune into Sint Maarten Gov Radio 107.9 FM for rebroadcasts of Ask CPS. On behalf of my colleagues at the Department of Communication, and of course, all of us here at the Department of Collective Prevention Services, I want to thank you for tuning in and being a part of the program. I'm Cedric Peterson. Have a pleasant day.